As officials track new COVID-19 cases, a lot of people want to take a closer look at how the disease affects people of color. Last night, we showed you how UT health researchers were mapping out communities at risk of more severe cases and hospitalizations. Their data showed many of those neighborhoods are on the east side of the city. Tonight, KXAN investigator Avery Travis has more on what the city says it's doing to target resources there.
As cases continue to climb, advocates are calling for a look behind the numbers.
So that we can be able to see what the outcomes are like for various communities. You still can face poorer outcomes as a person of color, particularly a Black person.
Texas is tracking statewide demographic data, but in almost 20% of cases, the person's race is unknown. The state says they get their data from reports submitted by local health authorities, and much of the time, their race or ethnicity fields are left empty because, quote, sometimes the patient prefers not to answer. Just this week, Austin Public Health released demographic data. For Travis County, in 57% of confirmed cases, the patient is white, 30% are Hispanic, 8% are Black, and 4% are Asian. Interim Health Authority Dr. Mark Escott says right now this data does track with the county's total demographics, but they don't expect it to be that way for long.
It's hard for us to fix the underlying inequities that have been in Austin for a long time, but we certainly want to avoid compounding that issue.
In a town hall hosted by the Austin Justice Coalition, health leaders said their next step is to start tracking hospitalizations based on race and to make sure testing is available for everyone.
They did have to close some of their sites out in the county area, but we are going to work with them on some additional testing sites in the Eastern Crescent.
The city couldn't tell KXAN how many testing sites were available in East Austin or other underserved communities. They say those locations are private until you're referred there by a doctor. But in that town hall, Dr. Mark Escott did say they're working on other solutions, including walk-up testing sites for certain communities at some point to give people more access. For now, reporting in Austin, Avery Travis, KXAN Investigates.
They're encouraging people who may not have insurance or a doctor to call the number they have set up in partnership with Community Care. Then you can schedule a phone visit and start the screening process. That phone number is 512-978-9015. We have that number at KXAN.com as well, along with an interactive graph of how COVID-19 cases are broken down by race and ethnicity.